Inspect and palpate the temporomandibular joint. Have the client sit. Put your index and middle finger just anterior to the external ear opening. Ask the client to open the mouth as widely as possible. So the tips of your fingers should drop into the joint spaces as the mouth opens. Move the jaw from side to side. Protrude and retract the jaw. For the normal findings, snapping and clicking may be felt and heard in the normal client. Testing for the range of motion. Ask the client to open the mouth and move the jaw laterally against resistance. Next, as the client plunges the teeth, feel for the contraction of the temporal and masseter muscles to test integrity of cranial nerve. So for the normal findings, jaw has full ROM against resistance, contraction palpated with no pain or spasm.
So test for back pain and leg pain. So if the client has a low back pain that radiates down to the back, perform the straight leg test to check for herniated nucleus pulposus. So ask the client to lie down in a flat or supine position and then raise each relaxed leg independently. So back pain. Independently to the point of pain. And then at the point of pain, dorsiflect the client's foot. Then take note that degree elevation when pain occurs, the distribution and characters of the pain, and the result from dorsiflexion of the foot. So measurement leg length. If you suspend that the client has one leg longer than other, so measure them. So ask the client to lay down again with leg extended. So using the measuring tape, measure distance between the anterior superior iliac spine and the medial malleus. So crossing the tape to the medial side of the knee. So for the normal measurement, the legs should equally with or within 1 centimeter. So for the normal, unequal leg length are associated with scoliosis. The straight leg test or the SLR test is commonly used to test to identify an impairment in disc pathology or nerve root irritation. It have also specific importance in detecting disc herniation and uteral compression.
Patient is seated in good posture. Make sure that the shoulders are not rolled forward and the scarf are not retracted. Also make sure that the patient do not shrug their shoulders.
Ask the client to place the backs of both hands against each other while flexing the wrist at 90 degrees with fingers pointed downward and wrist dangling. Have the client hold this position for 60 seconds. For the normal findings, no tingling, numbness, burning, or pain result from Fallen test. For the abnormal findings, if symptoms develop within a minute with Fallen test, carpal tunnel syndrome is suspected. Client may report tingling, numbness, and pain with carpal tunnel syndrome. Fallen test is positive in about 70% of cases and has a false positive rate of about 30%. There is no normal findings. And for the abnormal findings, however, if the test lasts longer than a minute, pain and tingling may occur even in clients without carpal tunnel syndrome.
So for the next, this is the patellar tap test to assess swelling in the knee joint. To perform the patellar tap test, have your patient in a supine lying position with a fully extended leg. Then stroke downwards just until you reach the suprapatellar pouch and press downwards. With the other hand, perform the same movement and stop just below the apex of the patella. While applying downward pressure, take one finger and press onto the patella and see whether it's floating. If you can feel that the patella is floating when you're tapping onto it, this means that fluid has accumulated under it and it is an indication for swelling in the knee joint. So for the normal findings, the knee extends, quadriceps muscle contracts, it ranges from 1 to 3, while no response or an exaggerated response is abnormal.
So, for testing pain or injury, if the client complains of a giving in or locking of the knee, perform McMurray test. With the client in supine position, ask the client to flex one knee and hip. Then, place your thumb and index finger of one hand on either side of the knee. Use your other hand to hold the heel of the foot up. Then, rotate the lower leg and foot laterally. Slowly extend the knee, noting the pain or clicking. Repeat rotating lower leg and foot medially, and again note pain or clicking. For the normal findings, we have no pain or clicking noted. Then abnormal findings involve the pain or clicking is indicative of a meniscus of the knee. Then there are a number of proactive knee tests for knee and ligaments injuries.